Hi, I'm Rachel,
I'm Jen.
and we're Two Sisters Health.
Two Sisters Health. That's so cool.
So we are combining our areas of expertise to discuss different parts of health. One thing that we'd like to focus on first is probably healthy aging and all of the facets around that. So Jen, do you want to tell us a little bit about you and why you might be an expert in that?
Sure. I'm a sociologist with training in a few different areas, but I have been working on a health and aging project for almost a decade now. I'm not one of the principal researchers on the project. I mostly do research administration. So I'm very well versed in what it is to produce a very large research operation and various aspects about that. And I'm pretty familiar with the research that's been done from the data that we've collected over the years. And so, yeah, so I do bring some expertise to the topic, but mostly I think about the world in terms of how people are affected by social structures, social norms, rules, their relationships. I think socially, 99 times out of 100. I have no medical training, even though I work with doctors on this project and I read their work, but I myself don't have any medical training.
And so looking at from a social perspective, how do you think that impacts getting older and staying healthy?
People who have strong relationships have better health and live longer. It's really that simple. There are some really interesting details about that, and it plays out differently for different people, for men and for women, and for people from different socioeconomic backgrounds, people from different racial and ethnic groups. So there's a lot to explore within that, but for everyone, if you have strong relationships, meaning a supportive spouse, good friends, you're gonna do better, live longer, and be healthier for the years that you are alive. That is very clear, and it's been clear since early in the study. Yeah.
And then the study that you work on, because you work for a research study, how long, can you tell me a little bit about that? Like how long it's been going on and when the end is, if there is one, and maybe the most exciting pieces of research that have evolved recently?
Oh boy, I'll have to.
Okay, that might be too much. Try to pick the parts you want.
Yes, I hear you, right. It's been going since 2005. And we're in the middle of collecting a fourth wave of data for the project. And I'll tell you, it's the National Social Life, Health and Aging Project. And it's conducted in cooperation between NORC at the University of Chicago and the University of Chicago. And I speak as myself, not on behalf of the institution. Anything I tell you is just based on my experiences with the project. But yeah, they've really found a lot of very interesting things about aging. One of the things they did early on in the project is they adapted methods. So all projects before this one started, when you collected actual physical measures like blood, urine, saliva, anything like that was always done by a medical professional of some kind, whether it was a nurse or whatever. And it had never been done in the home before. And this project piloted that and developed those methods where we train people who aren't medically trained. Some of them are like retired nurses or whatever who go into the homes, but not everyone, and it's not a requirement. You have to be okay with doing that, but you may have never had any medical training yourself in your life, and you are an interviewer for this project, and you go into people's homes and you help kind of talk them through the process of collecting these measures for themselves. So that was a really interesting innovation in the project early on, many years ago now. But we have data on husbands and wives, many husbands and wives, and that's unusual for a project. We collect a lot of information about people's sex lives with their partners, whether they're married or have a live-in, partner who they're not married to. And that's unusual also. Most projects don't collect that kind of information. We also collect, one of the things that really sets our health and aging project apart, because there are several that collect this kind of information from people, but one of the other things that also sets ours apart is we collect very detailed social information about people, who their top 5 close friends are, or up to 5. Not everybody names 5 people, and a lot of information about those relationships. And that's unusual for a project to collect that much information. So that's kind of where this project is set apart from other projects.
And when did it start? Did you say that?
2005, yeah. And we're collecting a 4th wave now. We were supposed to actually in 2020, but because of the pandemic, we had to delay and we had to adapt. It used to be a fully in-person, in people's homes interview. And now because of the pandemic, we adapted everything to try to be remote, over the phone. We are going to send some people into people's homes, but that's only possible starting, now in the spring, a little further out now that things are.
So have you been working on it since the beginning?
No, I joined when my son was born, actually, in 2012.
Okay.
Prior to that, I had been doing some educational research.
Got it.
Yeah.
Cool.
And what about you, Rachel? What expertise do you bring to this?
Well, I practice medicine. I'm what's called a physician assistant, which can work in lots of different parts of healthcare, but basically it's a master's level degree where we do a condensed medical school training. And when we come out of school, we are licensed to practice medicine with some oversight, which is pretty loose, but part of why our medical training is condensed. I studied science in college and then was a nurse for 10 years as a registered nurse. And now I've been doing this job for 10 years. So my actual practice and work and day-to-day is like a family practice physician. So I'm in rooms with patients all day talking about blood pressure and high cholesterol and evaluating their chest pain or shortness of breath, but also lots of depression, anxiety. And I work in an internal medicine practice. So I see probably the majority of my patients are geriatric, which is the term we give to people who are over 65, probably. I don't know that that's exactly the definition. I'll have to look that up. But people who are older and aging and often have multiple health problems. And I would agree that what I see every day is that relationships are critical to health. Certainly those older people that I treat who are isolated and alone, for one, they're not usually as happy, but stress levels go up and then that affects everything. So, but I definitely have more experience with, just different with how health affects aging and the medications that people are on and the things that actually shorten the life. But, there's a really interesting thought of what's more important, a longer life or a healthier, happier life. And so that's something I kind of deal with every day in practice also. So yeah, so I'm pretty excited.
Where did you come from before? Because it's not as though you went to school and boom, for this right off the bat.
You mean as a nurse prior? So I was a registered nurse for 10 years and I kind of worked everywhere in the hospital. I worked in, started out on a med surgical floor, which is just standard people with medical illnesses and actually probably largely a geriatric population too. And interestingly, the hospital I worked at, we did hospice care, which is pretty unusual for a hospital, but you can recognize that often when people aren't getting better with medical care, there comes this decision where the family decides it's time to stop treatment. And then they would transition to our floor and we would do hospice care, and they would die in the hospital with their family, and we would keep them comfortable. So that was my first job, but being in nursing as long as I have, I also worked in oncology, which is cancer treatment. So I did chemotherapy and treated people who were kind of dealing with the existential crisis in their lives from being sick. And then I worked in the post cardiac care unit. So after people had had open heart surgeries. And then after that, I moved into ICU, where a lot of our patients would be on ventilators and sick enough that you never talked to them. And by the time they got healthy enough to communicate, they would leave. So that was another view, but you know, you're with them a lot. One thing about, if you're a floor nurse, you can have up to 5 patients, and in the ICU you can only have 2. So you would kind of get to know their families more than the patients, but you would spend a lot of time with the patients. And then I worked in the ER, and that's pretty exciting. And you never know what's going to walk in the door. Somebody with their arm having fallen off, or someone, you know, just with strep throat, to just anything really. But interestingly, you know, it always kind of surprised me how much of the ER is taken up with psych cases. So people who are maybe not even sick, but having these crises and nowhere to go. So they come in, and sometimes they even maybe make stuff up so that they can eat some food and get some tests run and before they go home. But also, it's an interesting place to work. So that's where I was working when I went back.
How long did you work in an ER? Like, did you spend the most time as a nurse in one of those areas?
Probably ICU and ER. And when I worked those units, I would float back and forth. I probably spent, that was probably where I spent the longest time. And then, you know, this is actually not nursing, but right after I became a nurse, I went and got my yoga training. So I'm a certified yoga instructor. And that, I think, is just important in terms of health, to keep the mind-body approach in. Micah, could you not do that in here, sweetie? I'm also a mother. So there's always that. So kind of, you know, looking at health from a lot of different perspectives. And then I went to graduate school at Stanford. I live in California, still do. I kind of live up in the upper northern part of California that people don't know exists. People think Northern California is San Francisco, but really I'm super northern, like an hour from Oregon. Mount Shasta, nobody, you know, people have heard of the mountain, but not many people have been here. So, so it's kind of an interesting medical experience too, because we deal with rural medicine where we have no specialists, so we do everything.
Oh, yeah, right.
For people to get to a specialist, they have to drive about an hour and a half. So by default, we end up treating a lot of specialists.
Where's the nearest specialist?
Reading or Medford.
Huh.
So we have a general surgeon, we have primary care, we have 1 psychiatrist for the county, we have some mid-levels, which is what I am, and then like if you need to see a dermatologist, if you need to see a cardiologist, a rheumatologist,
you have to drive.
an oncologist, you have to drive. So yeah, it's kind of interesting. I've always kind of liked that, because you have to do a lot. Things that in bigger cities you would defer, we do. So like I do a lot of joint injections and small surgeries, which in a bigger city or practice, you'd probably send them to specialists. So that's kind of fun. But yeah, it's taught me a lot and given me some perspective on health. And so healthy aging, you know, I kind of say to my patients, if I just put it into a nutshell, sitting is the new smoking. if there is a fountain of youth, it's exercise and learning how
That's
to manage your
hilarious.
stress.
Yeah, I
Youth is
actually
kind
was
of secondary.
I was listening to a doctor's podcast earlier, and that was one of the points they kind of ended the podcast, the episode on, was exercise. Honestly, you know, what we know, if you want to stay healthy, make sure you're exercising. If you're not, so exercise, relationships, right? It's those are at least two things that
And, you
go.
know, mostly I practice prescribing medicine. I think when I went into it, I didn't realize that really what I was going to be is a drug dealer. And while I believe it has its place,
Right.
it's taken over the landscape to the point where it's all I do. And
Mhm.
unfortunately, we don't have much time for education, nor do we have that many people who want to change. So it's been difficult. It's been hard for me to kind of accept that that's my role, is just titrating meds up and down.
Maybe one of the things we can talk about over time is what can happen in society to help provide better infrastructure for people, for less people to get to where they're running to someone like you for pills, you know? Yeah.
Well, I can say one thing would be, you know, with work, many people just sit all day.
True.
So having like sit to stand desks and
Mhm.
maybe like a bike that you could ride while you're working.
Right.
And oh geez, Micah. Honestly,
That was about the same.
I think we
thing
just
going
work too
on.
much.
Mom, that
Yeah.
was the same as it going on.
Mhm. Well, Jen, this has been a great intro for our first episode. I'm not sure how long this has been, but would you say we?
Not very long.
Oh,
minutes.
really? A few minutes?
Tell me your kids' ages.
So Micah,
Remind me my niece
this
and
is kind of
nephew's
funny,
age.
and I'll share this with you because it's worth sharing. This is my son, Micah,
Hi, Micah.
who, so I have a yoga swing in my house, and there's my not a Peloton.
Not
I did ride today.
we
And
received no funding from Peloton.
what's that? We received no sponsors.
It's not a Peloton.
We don't have sponsors from Peloton, but I would be open to talking to someone if they see this podcast and want to get in touch.
I'm a sponsor. Does that count?
Micah is my sponsor at this point, and you are, Jen, too.
Have you been, Rach, have you been using your bike on that trainer lately?
I rode it
You
today.
have?
Uh-huh.
Oh, I'm impressed.
I ride it 2 to 3 days a week.
I'm impressed.
And I use
That's cool.
I
You
use
like
the
it okay?
Peloton app.
Oh,
Actually,
you do?
I do.
Hmm.
And I have a cadence meter on it, so I know my cadence. So like in the exercise classes, the instructors will say, get your cadence to 80, 30% resistance.
Huh.
So I know what my cadence is, and I just guesstimate my resistance by how hard I'm working.
Yeah.
And like today, I rode for 30 minutes. And I kept my heart rate at about 160. He just hit his head on the ceiling. Yeah, don't hit your head. So I get a really good workout, and it's to music, and the instructors are very motivational, and it's not trying to advertise Peloton. Although who cares if they get me a bike? That'd be awesome. It's $13 a month to do the app. And they give you 2 free months when you sign up. It's been awesome. I love it. And they have other classes. Although since I'm a yogi, I just do my own yoga afterwards. So I ride the bike for about 30 minutes, warm up, get hot, and then I do yoga for about 30 minutes. and
Yeah.
try to focus on doing core and push-ups and
Oh
stuff.
god,
Mhm.
now it's in my
And
head.
using my
yeah.
yoga swing. I don't swing on it like that. It's kind of funny, just so you know. The whole time I've been talking to you and filming, he's been doing that. And I've just been trying to ignore it. I've been ignoring it. I'm good at ignoring him. Just kidding. Mike is 9. You want to say hi, Micah?
He did.
Hi.
Yay. Hi.
We
Timer.
I recognize that shirt.
Micah, will you ask Forrest to go to check on the Brussels sprouts that are
Yeah.
in the oven? And we're eating Brussels sprouts.
Forrest,
today.
Forrest, Forrest, Forrest.
Forrest is in town?
Yeah, Forrest is back.
Cool.
So maybe he'll be our next guest. We have a friend who is staying with us who's very interesting. He's a teacher, and maybe he would be interested.
How long has he been back?
A couple weeks, maybe. Not
Cool.
very long.
Yeah.
Yeah. And then I have a daughter, Chloe, and she's 8.
You almost called You almost
It's
called
such
her
a
6,
blur. The
7,
kids
8.
age so quickly.
You
I
almost
know.
called her 6, 7, 8.
Yeah, she turned 8 just last month, so it's still new. And how about you, Jen? Tell me about your kids.
I have a almost 16-year-old girl and an almost 10-year-old boy. And I'm going to have to, I am just saying that out loud makes me realize I am dealing with a sweet 16 and a double digit
Second time
this
I've
year. So I'm going to have to do something big.
Uh-huh.
I better get to work soon planning that.
I'm back to swinging.
And what do you think are some things that people could work on to help with their
Woohoo.
health? Laugh more, right?
Yeah,
Laughter.
right. For sure. Well, that's a great question. I think it varies according to people's personalities and comfort levels. I'm a very social person, and so things going back to in person has been, hi buddy, that's my almost 10-year-old.
Hi, Alex.
Alex.
And so these guys are cousins.
Alex.
And you can see we're
I know, right? It looks fun, doesn't
just slammed your face on my leg. Excitement.
it?
It's okay if you laugh.
She's crying, but
Oh
come
no.
here, sweetie.
Hi,
This
baby.
is a demonstration for how to do it.
Don't. Okay, calm down. Do you want to say hi to Aunt Jen?
Hi.
Now when Chloe got here, it got
So we'll have to do most of our podcasts when they're at school.
You did not say that.
Although I don't know, this might be a selling point.
Wash my head. Do you want to look at your cousin? Stop. Do you want to? Okay.
Alex, you want to say anything?
Hi.
Please don't.
I was about to finish your pass.
So we just finished piano lessons.
Oh,
Another
fun.
thing that's important is anything that helps with thinking and stress relief, like music, I would say. Oh, Chloe.
Yeah, for sure.
This one's
I'm always going to suggest dance to
Mm.
everyone, even though that's not everybody's bag. But for anyone who is at all inclined, pursue it.
Did you ask
Do it.
for us to check on the
Living room,
Yeah.
go take a class, take an online class. I will say that the pandemic really grew the options for remote everything, and dance is included in that. So if you're shy, I suggest if you are, somebody who feels safe enough being around other folks these days, go take a class in person. There's no substitute for that. But there are online options, many of them actually. And so if you're too shy or want to get a few classes in before you feel brave enough to go do it in person somewhere, look into that.
Mm-hmm.
You can do it at home. You can turn your camera off. Even though I did online dance for almost 2 full years while everything was closed down where I live. And it wasn't as good.
Yeah, it's not.
But it was good. It was certainly better than nothing. It was
Mhm.
much better than nothing for me anyway. It was interesting because a lot of people really couldn't do it. Like people who I danced with in person for years, they were not willing. They maybe tried it once or twice and they just couldn't get into it. And I understood because it's not the same. But I was able to get a lot out of it, even from home on a screen. But that was kind of interesting to me. And there were some people who kind of were like happy to do it from the comfort of their own home rather than having to get into the car and go somewhere. And so it's interesting. People interact with these things really differently. I am very glad the stuff I like to do is back in person. So I'm happy going. And I haven't been doing anything online since I've been able to go back.
Oh, really?
Yeah, not really. But some folks are still doing both.
Yes.
All one or the
You're
other.
not going to land on your head. Don't even say that. If I land on my head, will you take care of me? That I don't think he knows how loaded that statement is. Right?
That's kind of dark, man. Does he mean like long term?
That's what I'm imagining. This is kind of a better view, huh?
It's not like, are you going to give me a hug? It's more like, are you going to?
Don't even say it. I basically was like, you're not going to land on your head. Why are you even saying that? So we have snow, actually, which is kind of interesting. We're in a horrible drought, and it started
that's
to
a good thing.
Don't hurt yourself, Micah. My goodness. I was teaching yoga when the pandemic started, and I haven't taught since. So let's see if you can see outside.
Wow, that's a lot of snow.
Yeah. So you can see I live kind of in the middle of nowhere if you've not been here. But anyway, I tried teaching online and it just didn't work for me. I couldn't motivate myself to do it. Actually, probably part of the difficulty was this.
Yeah, I know.
I was like, okay, we're going to teach. And the kids would run in and yell and interrupt. And it was.
Right.
Interrupting you, am I?
No, of course not. You're enhancing.
It's true, you are. Yeah, the main person I took classes with online was my local teacher here. And he actually rented out a studio, and he teaches West African dance, and he had drummers with him every time. And so he was not alone in a space doing it. He was there with the musicians. He won't teach without live drumming. And so, so it was interesting.
Uh-huh. Well, that's nice that he had some community still.
Exactly. Yeah, it was. It's so funny to watch this because my 15-year-old was very much like that for many years, right? And now it's hard to get her to do anything.
Yeah, it's a lot, but it's all worth it.
Yeah.
So family is probably important in health coaching.
Yeah.
I certainly know that it's important for me to have family.
Yeah, for sure. Me as well.
And actually, this is a pretty important topic right now because people have been so isolated for the last couple of years.
Mm-hmm. It's true.
And I'll be curious to see how many people struggle with coming out of that, right? And all the fears that people may have getting back out into the world.
Right.
For example, in California, the mask mandates are lifted as of next Friday for the schools even, which is new. So I wonder how
Right.
many people are going to have a hard time with that.
Yeah, I know, I'm wondering the same here. They haven't, actually, I think they said the 19th, so even, yeah, that's even a little bit longer than California, which is, Oregon is in last place once again.
The 11th is when,
Yeah, I'm not sure why they picked the date they picked here. It feels extremely arbitrary, but yeah, I'm really interested. I filled out a survey for my school district here about that topic just this week.
and I probably should get back to teaching. I was thinking about that actually this week, getting back to teaching yoga because I've taken such a long break. And actually, there was a time when all of this started where I just wasn't making time for exercise.
Yeah.
And I felt awful.
Yeah.
I think I aged like a decade. Maybe not a decade,
but a little bit.
Yeah, a little bit faster
it
than
was very
usual.
Stressful. It was ridiculously stressful for
It was really
it hit everybody. It hit, and there's a range, right? There were folks whose lives, like I think of our parents who their lives changed too, but compared to what how they were already living, it was relatively little change compared to people whose businesses were shut down.
Yeah, that's a whole other issue.
It's all over the place. There was many different, everybody was impacted, but everybody was impacted differently.
I feel pretty lucky living here. I mean, we've never had much here, but the little that we have, we did seem to maintain. Like even that first year, the kids still did swim team. We still did piano lessons in person. Their school was mostly open. We were pretty fortunate.
Yeah, that's very fortunate. That's great.
But yeah, it's been hard.
Yeah.
So we'll have to think about what our next couple of shows are going to be about. If we want to stick to one topic, I think we both have a couple of people that we'd like to interview. And yeah, so
ideas, we welcome suggestions too.
Well, do you think this is a good place to wrap up our first episode?
Yeah, I do.
I think, I have a 30-minute commute to work in the morning. So 30 minutes is a perfect time for me. Sometimes I get a little bit, I fall off on some of these podcasts that are like 2 hours. So maybe at least for beginning. And I think it's been 30 minutes because I put some Brussels sprouts in the oven and the timer went off and I had to have Forrest go check on that.
That's perfect. Yeah, good. Yeah, I think 30 minutes is probably perfect.
Yeah. Well, Jen, I love you.
I love you too.
It was
good
fun
to see you.
Do our first podcast.
Good to see you too, Micah.
I'm recording this, so I'll see what it plays back as. And I can just take the audio and everything.
Yeah.
But
I really hope you guys can take the audio. Don't take away the pictures.
I'm Rachel. And
I'm Jen.
My sister.
That's my sister.
And this is our very first podcast.
Two Sisters Health.
Sisters Health. All right. And there's no questioning it because obviously the kids just. Anyway, family is very important.
Yes,
love you and I'll talk to you soon.
Love you too. Bye, guys.
Bye.
I've been trying to pay attention.